Hey everyone, Bridget here at the AAFE Training Center. We are just going to be doing some lifting threads on my beautiful patient here. So her main concern was actually her neck. She didn't have any interest in lifting her face, which some patients don't necessarily want to lift their face. You can just lift the neck. So we're going to kind of focus on that double chin area that she really hates. We have done a few rounds of smooth threads, which have dramatically changed that. However, we now just have some loose tissue still that we want to tack back. So as you could see that I was marking the patient up, I always want to make sure I'm going over that masseter muscle. That's where my safest entry is and wherever I'm getting the best pull. So you can see I'm feeling for her antegonial notch, which is also important when doing the jawline. Because obviously if we hit that, she's going to get a massive hematoma. So first what I did was go in with a little bit of Lita with epi at the site to numb so that when I go in with my pilot hold, she's pretty comfortable. Lifting threads in general is a pretty comfortable procedure, I would say. Even compared to like lip filler, I don't think it's really comparable. I think it's really well tolerated because we use so much lidocaine. So as you can see here, I am going in with a cannula, and in that cannula I have a little bit of sodium bicarb and then some regular lidocaine, so 1%, 2% works. The reason I like to put bicarb in with the lidocaine is because it can actually help with the burning sensation. So we've felt like the past couple of times when we've done this, it's been much more comfortable for the patient, so I've continued doing that. Now I'm going in with my Arte 1s. These are actually Arte 3s. These are the 17 by 100 threads. They are my favorite for lifting the neck and the lower face because I feel like I get the best pull. She is not somebody who I would probably use an Arte 3 on her upper face. Like if I was doing her nasolabial fold or something like that, I would most likely choose the Arte 1s, and those come in 18 gauge or 19 gauge. The reason I wouldn't want to use 17 gauge on her in the upper face is only because she doesn't really have that heavy tissue. And I would be concerned that I would be able to see the thread. And obviously she's a little bit on the paler side. So that's why I decided to choose the 17 gauge, just because we are on the lower face and in the neck, which it should be less visible if it were to be placed superficially. So as you could see, when I went in with my thread, I'm staying in that subdermal plane. And once I get where I want to be, I make sure to put a little bit of pressure on the tip of that needle with the thread, because the 17 gauges are obviously, you can see, a little bit thicker. So sometimes they're more difficult to engage. So you want to make sure to hold some pressure on that tip and twist back and forth so that that thread is able to come out of the cannula. So then obviously I'm going to over exaggerate the pull and come straight out. Now coming down to the neck, we're going to be doing the exact same thing. So first I went ahead and numbed the pilot site with Lita with epi. And then I went in with my 18 gauge pilot hole, and now I'm going in with my lidocaine and sodium bicarb mixture. So now I'm going in with my 17 by 100 millimeter thread on the neck. And as you can see, I am staying in that subdermal plane. If I need to back up, the 17 gauges are really nice because they already have a little plastic stopper on them, which basically is preventing the thread from engaging if I need to back up. So as you could see, I had to take that stopper out to be able to engage the thread. So I went ahead and put a little pressure on the tip, and then I went ahead and exaggerated the pull and came on out. So I'm going to do the same thing. I decided to do a 2 vector in the neck just to get me a good pull, and then also a second vector along the jawline to, again, just really tack everything back. You can do 1 vector, you could do 3 vectors. It doesn't really matter, whatever gets your patient the best pull. She's actually coming back today, so I'm going to be able to see what she looks like now that she's been fully healed. So I'm excited to see what the lift looks like. But as you can see, I'm doing the exact same thing. So putting pressure on that tip. If I was using the Arte 1s or Arte 2s, which are 18 gauge and 19 gauge, I would not need to be putting pressure on that tip. It's just really important too with the 17 gauge, or you'll probably find that it's not engaging well. So I'm going to kind of like reverse pull them to make sure that those threads really engage well. And then now I'm trimming them down. You want to make sure you stay really, really close to the surface of the skin, just because if the thread is poking out, there's risk for infection and complications. So I really like to make sure that it's pretty flush with the skin when I'm trimming it. Now, as you can see, I'm putting on some arnica and just massaging the area. If there's any dimpling in the tissue, just make sure to tell your patient that it can be completely normal and that they will settle out. If there is any complications with threads, it's kind of nice because the threads dissolve. So once the threads are gone, the complication should also resolve. That's why I really, really love threads. And if you ever have a problem, heat is a great tool because heat will break down the thread quicker. And then I always like to put some Band-Aids on at the end just to make sure those sites stay clean, and they keep that on for 24 hours. Thank you so much for watching.